It is not uncommon for babies to get skin rashes. Rashes can look different on different babies' skin. As a parent, you may not know if the rash is something to worry about. Remember that you can always call your baby's doctor's office and ask to speak with a nurse if you are concerned. Some rashes are more commonly seen during the first few months of life. Let's look at the rashes that are more common at birth. Jaundice. Jaundice is commonly seen within a few days of birth. It appears as a yellowing of the skin, lips, and eyes. Many babies go home from the hospital with a little bit of jaundice. But if your baby looks more yellow in the eyes or skin, is not eating well, not making as many wet diapers, or is hard to wake up, it is important to call your baby's doctor's office right away and ask to speak with a nurse. Mongolian spots. These gray-blue patches usually appear within the first year of life. They might look like a big bruise, but they do not hurt. They may show up on your baby's back, bottom, or legs. These spots are caused by simple differences in skin color and are perfectly harmless. They range from the size of a pinhead to 6 inches across. Erythema toxicum. Half of all newborn babies develop this rash, usually within 2 to 3 days after birth. The rash begins red and raised and can appear on the face, arms, or legs. This is a normal baby rash. It is not warm to touch and does not cause any problems. There is nothing that needs to be done about it. It will go away within a few days. White bumps called milia. Milia are small white bumps that are common on newborn skin. Milia are generally seen on the forehead, cheeks, nose, and chin. Leave them alone. They will go away on their own. Newborn dry skin. Dry skin is common. Your baby was surrounded by fluid in your womb for several months. It takes a while for your baby to get used to its new surroundings. There is no need to do anything. Your baby's dry skin will get better on its own. Cradle cap. Cradle cap is very common, and just like its name implies, you typically see it on the scalp. Most of the time, it appears in the first several weeks after birth. It will get better on its own, but may be treated if it becomes severe. Remember to call your baby's doctor's office and ask to speak with a nurse if you think your baby's cradle cap is getting worse. Baby acne. You may think that only teens and young adults get acne, but your baby may get it too. Baby acne shows up around 2 to 3 weeks of age because of mom's hormones. The pimples are harmless and won't leave scars. Just leave them alone and keep the area clean with water only. Heat rash. You may see this rash, sometimes called prickly heat rash, if your baby gets too warm. You may notice it on your baby's neck, armpits, and diaper area. It may itch and make your baby uncomfortable. You can help by keeping your baby in a comfortable temperature. Most of the time, prickly heat will go away on its own in a couple of days. Eczema. Eczema can begin in the first few weeks of life or may not begin until your baby is older. Eczema is dry skin that gets red and irritated, mostly seen on the scalp, face, trunk, elbows, knees, or the diaper area. Apply Vaseline or an unscented moisturizing lotion to keep skin from becoming too dry. If the skin continues to look red and irritated, contact your baby's doctor's office and ask to speak with a nurse. For more information,